My name's David Morrison. I'm a bioengineer and I work at Royal Perth Hospital. I did my PhD in chemical engineering, and as a chemical engineer there's a wide variety of professions or occupations you can go into, from the oil and gas industry, from plastics to many other different fields. But I was very interested in working in a field where I could help people, and chemical engineers can actually work in the medical profession, which is how I sort of fell into this role. And my first job after I did my PhD was working on the world's first artificial cornea, which was also developed here in Western Australia. And after that, about 10 years ago now, I started working at Royal Perth Hospital in custom medical device design and manufacture. For most people, you can get an off-the-shelf medical device. So if you need a hip replacement or a knee replacement, your surgeon will just select an off-the-shelf device for you. For some people, they can't use an off-the-shelf device. For example, they might have suffered a significant trauma or might have some unusual anatomy. And in those cases, they need a medical device custom designed for them, and that's my job, to do design work for those devices. Our department provides a statewide service for surgical planning and custom medical devices. So we provide devices for adult and pediatric patients, and that can be as simple as a surgical planning model. So we take the patient's CT data and we 3D print a model of the patient's anatomy, which the surgeon can use to explain the procedure to the patient, or also pre-plan the patient's operation, which saves time in the operating room and saves money and gives a better outcome for the patient. So this is a patient who has quite a severe scoliosis. This is a mid-teenage female. So we made this model via 3D printing, and we take the patient's CT data, and on the computer we assemble it into a 3D object, which is then 3D printed. We give this to the surgeon, and they can use it in theatre, or they can use it before the operation to plan the surgery. One of the most common devices we provide is a custom titanium cranioplastic plate. If a patient loses a section of their skull, either because they've had brain surgery or because they've had a trauma such as a road traffic accident or a one-punch assault or some other traumatic brain injury, they have a section of skull missing, which we then replace with a custom formed piece of titanium. Now, these work really well in the patients that we provide them to, but obviously we want to move on from putting large pieces of metal inside people's body to solve a problem. And one of the promising paths to do that is called tissue engineering, and that's where we are basically encouraging the body to heal itself. So we have a clinical trial currently in progress where we're using a 3D printed ceramic onto which we've preloaded stem cells. We insert this tissue engineered construct into the patient and encourage the patient's own bone to regrow. Essentially, we're regrowing the patient's own bone inside their skull, as if the bone has never been lost in the first place. We're currently recruiting patients into this trial, and we hope to see some results within the next year.